Good afternoon, everybody, and welcome to the first of our monthly Community Transformation webinars. I'm Megan G, Communications Manager for the programme. I'm very happy to meet you all today. Just a little bit of housekeeping. If you wanted to turn on live captions for the webinar, if you go to the bottom of your window and click the three dots, if you click on that, you can then turn on subtitling if that is useful for you. And I'm now going to hand over to Rachel Coffey, who's going to start the presentation for us.
Well, hello everybody. Welcome to our first of a series of monthly webinars on the community transformation. My name's Rachel Coffey and I'm the Programme Director for the Transformation Programme for Adults and Older Adults. And I'm just going to hand over to Penny to introduce herself.
Good afternoon. Oh, yes, it is afternoon, is it? Good afternoon, everybody. I'm Penny Fenton. I'm the Community Pathway Lead. So I'm a nurse by background and I work both for Sussex Partnership and across the integrated care system on community transformation.
Thanks, Penny. So as I mentioned, this is the first of a series of webinars, and we know that not everybody is necessarily starting their knowledge of the community transformation at the same point. So what we decided to do today was to really cover from the basic level upwards about what this transformation is about and what it's trying to achieve. And we'll kind of go through a bit of an explanation of what it is and how it should feel different, but also talk about some of the progress that we've been made and also some of the next steps that we've got. And lastly, about how you can get involved. And we will be showing at the end sort of an email address that you can get in touch as well, because we really want these webinars to cover areas that you're really interested in, and we will build on that knowledge over time, but we're also really welcome your feedback so that we make these transformation webinars as useful as possible for all of you. So on that note, we'll start with a little bit of background. So this transformation is covering, from our perspective anyway, adults and older adults. There are other transformations as well for the children and young people and the urgent care pathways, which are part of a bigger kind of long-term plan for the NHS around really transforming our mental health services. This transformation brings our local services together. So that includes our mental health services, partners from social care, primary care, local authorities and voluntary community and social enterprise services as well. So it's a really big group of partners working together to transform the services that we have for our community and also for our staff too. The new services will be much more integrated and will be designed around the needs of our local community and developed in collaboration with the people who use them as well, which is a really important part and pillar of our transformation, about making sure that this is designed by the people who will use it, along with our staff and our partners. So the kind of outcomes that we will be looking for from this are patient outcomes and experience will improve, and also holistic needs will be met, because we know that people often have other challenges in their lives that really do lead into their mental health challenges that they have, and we really want to be doing something that's much more needs-based for our community. So we also, as a key part of it, is about our staff, and our staff satisfaction and retention will increase because we'll be working differently and in a much more integrated way. And a key part of this is also about how we work collaboratively across our broader system. It's a really collaborative programme, and I hope you'll get a kind of sense of that as we go through the presentation today. So if we go on to the next slide, we're going to show you this is a mental health kind of a video, which really is about 5 minutes long, but it really kind of explains what this transformation is trying to achieve. And I think it will be really helpful for everybody, especially if you're coming here with not much knowledge of the transformation as it is. So I'll hand over to Megan and she'll play that.
The NHS long-term plan promised an ambitious transformation for community mental health and an extra £975 million per year by 2023-24. The aim is for 370,000 patients with severe mental illness to have access to a new integrated model of primary and community mental health care, designed to improve patients' experience and outcomes. For most people with severe mental illness, the diagnosed problem isn't all they need or want help with. They need mental health services that go beyond treating symptoms and illnesses. Integrated services that see a person rather than a diagnosis, and that work together to promote their all-round well-being. Within a siloed system, each service is separate and has its own eligibility criteria, assessment processes, and data systems. This means people with severe mental illness don't always get the support that they need, or that makes a difference to their well-being. Even after being identified as eligible, baffling admin and long waiting times create a real risk of people not getting help in time, or giving up on the system entirely because they feel too powerless, hopeless, or exhausted to continue. The transformation aims to create a care model that provides holistic, person-centered care for people with severe mental illness. One which involves the integration of physical and mental health, the integration of primary and secondary care, and the integration of healthcare and social care services, so that people with long-term needs or specific mental health concerns will receive faster access to higher quality care. The new model marks a significant culture shift. Rather than being done to, service users and carers are equal participants in the design and delivery of their care. In the new culture, all care pathways are specifically co-produced and co-designed by service users and their carers, with their needs at the heart of every decision that is made. It is a holistic, community-based offer that includes access to needs-led, personalised and trauma-informed care. It also aims to meet people's social needs, which often significantly impact their mental health difficulties. The new model is inclusive and aims to proactively ensure equality of access, experience, and outcomes for service users from different backgrounds. The transformation has been trialled by 12 early implementer sites across England for 2 years before the main rollout in April 2021. While the pandemic has a huge impact on these pilots, they still identified 3 key priorities for transformation. Governance that ensures strong cross-sector representation of senior leaders. Partnerships that offer genuine engagement with local communities, starting as early as possible. And a robust plan to spend the money. This unprecedented investment requires proactive and innovative thinking on recruiting clinical and non-clinical workforce, as well as contracting with other organisations. April 2021 marked the beginning of transformation in every local health and care system across England. Everyone involved in caring for people has a role to play. Local authorities to ensure better access to social care, housing, drug and alcohol services, and financial advice for people with severe mental illness. Primary care providers to identify patient needs early, to embed new staff and seek out ways to partner with teams that have specialist mental health expertise. Secondary care providers to remove thresholds and barriers to access, to provide choice of more meaningful interventions, flexible care, and a multi-sector partnership approach. The third sector to be involved in the support of non-clinical needs and work with communities that mainstream services struggle to reach. And last but definitely not least, service users and carers to provide lived experience expertise. To co-design and develop these new models and work within them to support others on a similar journey. Each of these partners will need to be bold, to face change and work together. But for the first time in a long time, We aren't being asked to do more with less. This transformation of community mental health represents a genuine investment and a genuine opportunity for meaningful change. For more information on playing your part, please visit any one of the following links.
Thank you. So I really apologise for that, because it all worked well when we went through this earlier, but you know, it's never good unless you have something like this happen when you're live. But thanks for your patience in that, and hopefully that gives you kind of an understanding of kind of the objectives of where we want to get to with the community transformation. And what I really wanted to do now was talk about how the transformed mental health services will feel different. And we're looking at how we kind of look at that so that people can understand how we want this to feel different for everybody when we move through this transformation, and what we want to see as an outcome. So we're looking at it in different kind of areas, but from a health and care system, you know, this should reduce the pressure and reliance on the crisis and acute services. And we know that's very much kind of one of the challenges that we face every day today. And, you know, the system's kind of broader challenges, and making sure that what we can try and do with this transformation is bring down, you know, is deal with people at the beginning, you know, and in a primary care setting, so we can stop them kind of getting in the river rather than having to pull them out at the other end. So, you know, the idea is that we actually provide a lot more service and support at the primary care level. And, you know, our services are much more integrated so that we can stop people going and getting more ill and ending up in the kind of acute services. You know, obviously key to us at the moment when you think about the challenges from our perspective is that really reducing the out of area hospital placements and financial savings across the system. And I think what I really want to make sure that you understand is this isn't about a reduction of cost. This is much more about how we reduce the costs in the inpatient and acute services by bringing services and making services available to people much earlier on in their journey. And I think, you know, we're also, as you'll see when we talk about some of the progress that we've made, there's been a huge investment in new roles coming into the services, not only in primary care, but also in our secondary care areas as well, as part of building and making sure that we've got, you know, the resources that we need to be able to drive the integration and drive the transformation as we move forward. And then also a coordinated approach to share problems, so making sure that we're working in a much more coordinated way. And when we think about, you know, Sussex partnership staff, it's, you know, renewed sense of purpose for community-based services, you know, really making sure that we can work together and give people the outcomes that they deserve. Support from an integrated and multidisciplinary team, so a whole system team working together across the board to drive better outcomes for our patients and also for our staff. Well-resourced teams, simpler processes, and actually more non-clinical roles such as peer support. So a big part of this is about bringing in our voluntary sector, and I'll come on to that, and actually having more help available to support the clinical staff in SPFT. And then from a patient and carer perspective, you know, an integrated service that treats you as a whole person. So really looking at the holistic needs of someone when they come in and being able to deal with that at the same time as some of their other needs. You know, not discharging people or excluding people that make people feel unsupported. So, you know, what we want to do is have a very seamless line from primary care into our kind of secondary and, you know, other care if it's needed, but actually there's a support that comes back as well to the primary care level. Quick and easy access, supporting people to stay well in their own home, in their own community, and being in charge of their own care. From a primary care perspective, it's seamless and timely access to advice and networks to better support patients. A wider offer that you can talk to patients and access expertise for. Simpler processes and shared paperwork, so really looking at how we assess people in a much more holistic way and making sure that they don't have to continuously tell us the same information. And improved support and training opportunities as well for those staff. And then from a VCSE perspective, or our voluntary services, it's really integrating the support that they have, that we had it in the wider community, but really making sure that we integrate that support and advice from other sectors into our kind of model of care, more flexible and long-term commissioning, because I know a lot of the challenges from a VCSE perspective have been about the short-term nature of the contracts and how we really kind of build and strategically build that as part of our offer to our people. Recognition that they are an important part of the entirety of the role in the system, and also we're really looking to develop that whole VCSE sector as a part of that. So hopefully that kind of gives you some understandings about how we view this will look differently and how we will work differently. And now I'm going to hand over to Penny, who's going to talk a little bit more about some of the workshops that we've done and some of the work that's going on and how we're building this transformation.
Thank you, Rachel. So the transformation will grow at pace over the next year and beyond that, and it's within the transformation framework that we've been held to account to really nationally, which is really useful, and it's how the money flows. And although this is some about the money, it's also largely about culture change and how we can work differently with each other to improve our services. And to explore some of that, we've decided to start with 3 sites, and that, when I say we, it was the system that had a good conversation about where we should start, and that includes service users, carers and staff from across all services, to think about how we can have the biggest impact in the first instance. So the 3 areas that you can see on the screen now, which are Crawley for West Sussex, High Weald, Lewis and Havens for East Sussex, and Brighton and Hove, are going to be our first wave integration sites, and work for that is already underway. So there has been some workshops, which I'll go on to shortly, across those 3 areas, as well as some system-wide workshops to think about how we might move forward quickly. And just some interesting things from those things already. For example, from the High Weald, Lewis and Havens site, there was really good sharing of the difficulties in the context at the moment of secondary care and access due to very long wait times for routine assessments, and some work already happening about how we might be able to start to review some of those routine wait times, because there's absolute recognition, of course, that this is not great for people who use our services who are waiting a long time, and really difficult for us as clinicians and staff who don't want our service users to wait, but we're having some real challenges, as we know, at times in the context of recruitment and the rise in demand across the system. So those 3 areas are really working together using a QI approach in bite-sized chunks to really kind of learn how we can do things differently at quite some pace, and to share that learning across the system. And you'll see that this first wave will cover 10 primary care networks. We've got around 35 primary care networks across all of Sussex, so we will hopefully get quicker as we go along, and as we learn more and more, and of course as the rest of the system starts to become really engaged and involved in development of this work, because clearly we can't do this on our own. And it also allows us to have neighbourhood or place-based focused care. So we're really breaking things down into neighbourhoods. So we are starting to gather much more information at place about different areas and about what that population needs, with one of the biggest opportunities for us to deliver much more as close to home as possible when we work across our partners. And you'll see at the bottom the current ways of thinking and who we need to start to bring together much more tightly to be able to work on those things. And the bit at the bottom where it says ATS, of course that includes SOAMs, our older people's services, because this transformation includes adults and older adults. There is a separate dementia funded piece of work, but we know there's often integration between those 2 things. Thank you. Could I have the next slide, please, Megan? So back to the system-wide workshops, we held some system-wide workshops back in August, and they were system leads across voluntary sector, primary care organisations, experts by experience, Sussex Partnership, emotional wellbeing services, a big range of services to come together to really start to explore this in a little bit more detail, to understand what we were trying to do, understand what NHS England has given guidance for, and we'll talk about it at the end. But for people that haven't seen it, please reference the adult and older persons framework for new community mental health services. It's easy to read and really useful. And for us to start to reach a shared understanding of those agreed principles and how they'll underpin transformation. And I'll talk about those again shortly. And really to start to agree deliverables and priorities of what the transform model might look like, what it can achieve at place and neighbourhood. And they really led to those place-based workshops that I talked about in those 3 key areas. And they've all been hosted now with invited guests across the areas, as it explains in the slide. And that was really to start getting much more into the detail. We had staff from all of the agencies, and it was much more focused on people working on the front line, team leaders, and a range of people from both primary care networks, as I say, voluntary sector, Sussex Partnership, etc., and it was really useful. We did some feedback sessions after that, and we're gathering this information for future learning. But right now, they're being written up, all of those plans, and they will be turned into kind of project plans, if you like, and you will hear much more towards the end of this presentation about how we start to really put the meat on the bones locally and how you would like to be involved in those things and really contribute to them. Thank you. Have the next slide, please. So what we've achieved so far, there was a lot of investment in the first instance in emotional wellbeing services, might be known more as Pathfinder in West Sussex, but really start to build additional services into those wellbeing services. There are new roles that are called R's roles, which are additional responsibility roles, which are nationally funded to increase some initially clinical roles into primary care networks, and that was largely focused around qualified practitioners in the first instance, and also to expand the voluntary sector input directly into GP practices. That's really built over this year, and the plan is to continue to expand and work on those things. And that's really the start from that end of the spectrum around bringing things much more closely together with what we call at the moment secondary care, and start to think about how we work together much more effectively and differently. And we've already seen the beginnings of some of these things around looking at shared triage, which is just the tip of the iceberg. There's lots of enthusiasm and excitement around virtual or physically shared hubs and wellbeing spaces, all really being discussed at that point in emotional wellbeing services, and starting to be in what we at the moment call ATS and older people's services within Sussex Partnership. The national team have also asked us to focus specifically, as was shown on the video, on three areas of need for people with serious mental health needs, and that's eating disorders, complex emotional needs associated with a diagnosis of personality disorder, and community rehabilitation. And these are being developed and strengthened. There are cross Sussex steering groups in place, which are multi-agency, that have been set up for all of those specialist areas, and there are local implementation groups. And already we've seen lots of activity and things happening. So you may have experienced, and your team would definitely have experienced, some training around eating disorders with improved work around psychological therapies training, or yes, it will be around those things and led by your psychology and clinical leads in your areas. You will have seen rehabilitation services if you work in, particularly in coastal West Sussex. You'll have seen a whole new team which has now emerged and launched across 2 sites in the Chichester area and in the Ada, Arran and Worthing area. And those services are really learning all the time from each other across the whole of Sussex to think about what we may need to do next to make sure we have a consistent approach everywhere. They bring in housing, voluntary sector partners, our primary care networks, etc., which is really the direction of travel we need to go in. We've also seen some investment in community enhancement, and that's largely around substance misuse roles and other plans that are starting to be rolled out within secondary care. There's a number of roles that you can talk about locally within your areas. And we've also developed quite a big infrastructure to help us do all of this work. And we've got a lot of input from digital, and we're starting to think about quality standards. That's things like reviewing our care programme approach policy, thinking about how we move away from frustratingly, our work being assessed on numbers. How many care plans do you have? How many people you can see? And much more to what's the person's experience like? What are their outcomes? Did they recover? Much more clinically meaningful outcome measures that we will start to work on. And you'll start to have questions and start to really have the opportunity to be involved in that. And in fact, we've already got a very proactive and lively care programme approach group for clinical staff and experts by experience. So that's where we are at the moment. Still a long way to go, but an exciting time. And it feels like we're really at the cusp of moving quite quickly now into the kind of more general services around assessment and treatment services and older people's services. So it's an exciting time and really key now for us to really work together and have really good local co-production from both our experts by experience carers and frontline staff. Recognising that's a challenge, and we'll talk about that shortly, and we'll make that as easy as we possibly can. Thank you. I'm going to hand back over to Rachel now about how to get involved and a bit more of a discussion around those things. Thank you.
Thanks, Penny. Okay, so just because obviously we are, as Penny mentioned, we are looking at, you know, at the moment on the first wave integration sites around those areas that we talked about, but obviously we really want to get more people involved as we move forward as well. And to that end, we're going to be setting up a transformation network. So what we'll be sharing more information about that in December, but really what we want to do is make sure that we've got people who are interested and want to be more involved in this transformation as part of a kind of a network across the system that can help kind of communicate around the transformation, but also really key is getting kind of feedback from your teams and, you know, wider around how we shape our communications so that we understand kind of the things that are challenging or the things that people want to know more about, so that we can really drive that to shape our communications. So we'll be getting involved or getting a lot more information out about that over in December, but this is a key area or a key way of being able to get involved in the transformation as we start to roll this out into bigger geographical areas and to kind of the broader kind of transformation as well. So if you are interested, there's an email address here. Well, we're going to follow up afterwards. I'll come on to that in a little bit more detail, but if you are interested and it's something you'd like to know more about, then please get involved or send an email for now, and we'll just be communicating a lot more about that, so you can kind of get an understanding of what it would be and how we envisage that working. So we'll do that shortly in December. Next slide, please. Okay, so in terms of how to get other areas of getting involved as well, so for Sussex Partnership staff, it's raising this in your teams, having conversations, going to the CDS boards. There have been a number of presentations about the transformation at some of the CDS boards as well. So, but we'll be, as we move forward, providing more information to be shared at all these different areas. So it will be easier to communicate consistently across the board about what we're doing and how people can get involved. Experts by experience, we've got really great lived experience groups, and we've got the Scale network, so there we can share more details about that. So people with lived experience, there is an opportunity for you to get involved across all the different places. Voluntary sector staff, we've got transformation leads for that represent the whole of the VCSE, which will share their details as well if you want to speak to them and get involved there. You can follow our social media for the latest updates. They're the details there. And also, if you subscribe to receive the Community Transformation monthly newsletter, which is something that we have started to do, and that will give you a bit more of an overview of exactly what's going on in the transformation and how you can get involved. And also, it will allow you to kind of get a lot more knowledge and understanding of what's going on as well. And actually, if you, we've got several people on there. The webinar today, we obviously want these to be gradually more people coming to them, and actually if you can share that information with people as well so that they know how to get involved, that will be really helpful. So I think if we go on to the next slide, so just before I come to the questions, just to note that later today you'll receive an email from our community mental health email address, which will be an engagement pack, which really covers all of the things that we've talked about today. So it gives you a bit of an understanding and things that you can read through and also share. And also you'll be getting a survey link as well, so that we can get feedback on the webinar. Apart from the technical challenges, we can get feedback, any learnings, any things that you would want to see in future webinars as well, because we really want this to be really shaped by you, so that we're coming to you with the information that you need, and we can kind of really describe the progress that we're making. So on that note, I think I will pass over to Megan, who will do the Q&A.
Thank you, Rachel. So just a reminder to everybody that we have got a Q&A section now. So if you have got any questions, do put them in the Q&A box. We have got one question so far, so hopefully a few more will come in. But the first question was, how do neurodiverse people with mental health conditions such as anxiety and depression fit into the community transformation?
Shall I?
Yeah, Penny, go for it.
Rachel.
Yeah, thank you. Yeah.
So across all of the work streams, we've been in touch, obviously, with parts of the Sussex Partnership side of the services that provide neurodiverse services, and checked we've got some representation and input into the transformation. And there's also national guidance as well. So, for example, there's been a lot of work around outcome measures, and there's been some consideration and thought about the use of scales for people that have neurodiverse issues, conditions, etc., and how they may or may not be able to use it. So it is a learning process, but they are absolutely included in all of these things, and we're working together. Neurodiversity is a really good example of people that we're needing to liaise with and pull into the system and the planning all of the time. So that is definitely happening at a Sussex-wide level at the moment. And it's the same thing really for younger people. So there's specific needs between 16 and 25-year-olds, for example, and specific needs about older people. We're working very closely with people with expertise in those fields. So it doesn't just feel like a bolt-on for those individuals, but it really feels like it's been able to address some of those needs. So I hope that answers the question or gives some assurance. But of course, if you are somebody that wants to be involved, drop us a line and that would be great. We can pull you into those discussions really easily. Thank you.
Thanks, Penny. A couple more questions have come in, which I think I'll be able to answer. So the first one was, has the webinar been recorded and will it be available for colleagues to access online? So the answer is yes. All of the webinars will be recorded, and we will be making them available both on the Sussex Partnership intranet page, but also we've got a public webpage for community transformation. If you go on there onto the latest news, you'll be able to view the webinars on there. So do share it with your colleagues or anyone who wants to know more about the transformation, so we can get the message out there far and wide. And another question was, are we interested in clinical staff registering their interest for the transformation network, or our admin staff included as well? And the answer is we want everybody to get involved. This isn't limited to just staff or just carers, just patients. We want everybody who is interested in the community transformation, who wants to be involved and wants to help us spread the word about it. So if you are interested, please do email us, so we can keep you informed as to when we've got obviously more details to share with you about how you can get involved with that.
Megan, can I just say on that, it was really great to have, we had a admin lead at the, can't remember which one it was now, it was the East Sussex workshop, and it was incredibly helpful because that process and how we manage things differently, admin involvement in that, business managers, admin, really, really key. Same for estates. All of those places are really, really key kind of building blocks for us. So please do get involved. And it was really beneficial at the East Sussex workshop.
Yeah, and I think just to follow on from that, Penny, I think what we're trying to do is build this transformation from the bottom up, because you know, from us, you know, you're the people on the ground who understand the challenges that we've got at the moment, and probably have a lot of the solutions about how we can do this better. So we really want to get people involved to look at how we do things differently and how we work more collaboratively. So, you know, that invitation is open to all, and I think, you know, the more people that can be involved and the more areas that can be involved, the better the outcome of the transformation will be. So I think that's definitely something that we want to do, and you know, we're really excited about this opportunity as well, because we think it's really going to start to, as we progress with the transformation, as we start to see it moving at pace, you know, you all of you are going to be really key as part of that, to help us kind of make sure that everybody understands what's going on, because it's a complex project. There's a lot of things going on, and, you know, bringing that together and being able to communicate that can be challenging at times, but we really want to make that effort to be able to do that. And as I said as well, you know, you're the ones who will kind of come up with the amazing questions and feedback as well, to help us make sure that the communications and engagement that we're doing is really fit for purpose. And actually really kind of covers the things that we need to do. So, you know, that, yeah, big ask for us to make sure that anyone who wants to do that will be involved. And obviously, you know, I'm sure there'll be questions about what will it mean, what time will that mean for me, etc. And we will kind of cover that when we talk about what this transformation network is in December. But really, for us, you can get as involved or not involved as you're able to. I think it's just trying to make sure that we can spread the word, because you know, I think there's a lot of there's a community transformation going on over here, and I don't think that necessarily everybody understands the opportunities that we've got to deliver something different here for our community and for all of our staff, and actually really making sure that we're taking on board your comments and making it the best we possibly can. So I think, sorry, that's a rather rambling answer. And I was also going to say, Megan, I hope you can edit out the technical error from our webinar before we share it far and wide.
Yes,
so,
yes,
yeah, so yeah, that's brilliant. Thank you.
So we've got some more questions that have come in. So we've got one around how do we intend on overcoming the current barriers that we have when it comes to information sharing and shared systems between organisations and partners, and yeah, can we, you know, kind of speak a little bit about that, recognising that it is really complicated?
Shall I pick this one up?
Yeah, I was going to say, Penny, because if you, yeah, that would be good, thanks.
Yeah, okay, so this is complicated, absolutely, but it is also really exciting, because as we know, technology is moving at pace. So you will have seen some changes already with things like Plexus, and us kind of really trying to test how systems like that may help us have more and more shared information across the system. So that we have a digital team that are really heavily invested and working on this with us. It's a national problem, so it hasn't been solved yet nationally in terms of a single interoperable system, and it might be there's a slightly different answer to everything being on one system. It might be more about how we share bits of information from different systems. And for those on the call from Sussex Partners, you would have seen Plexus and those in primary care networks. So we're beginning to build at pace. There are other areas like My Health and Care Record, and that speaks much more to people holding their own information, so holding their own care plans, holding their own outcome measures, holding their own stories, which is being built and explored all of the time. And there is a lot of work happening about how do we share day-to-day information, that clinical recording of information that feels so important, particularly across primary care networks and voluntary sector and Sussex Partnership. And as I say, there's streams of work happening, and you will have started to see the impact of some of those streams of work already. And again, if you're particularly interested in digital, please let us know and drop and say in the email if that's something that you're really keen to be involved with, because we are really keen to hear and understand and listen to any ideas that people might have around priorities for that. But there is a work stream, as I say, up and running, with our digital leads really working on it. One of the challenges we have is Sussex Partnership has quite a robust digital team working on these things, and it's really we're really particularly interested if you're from any voluntary sector, provider, because that's the challenge of really making sure we can engage people from a digital perspective and build on these pieces of work across the system. So we'll continue to work on it, and we'll have a future webinar, if that's helpful to people, around digital and where we are in much more detail. Thank you.
Thank you, Penny. Very conscious of time, so we've only got 1 minute left, but very quickly, how will local population needs and data be used to decide how additional mental health support roles in primary care are allocated, recognising that some areas have a higher number of people with serious mental illness?
I'll come on to that if that's okay, really quickly. I think I think if we look at the general kind of direction of travel, health inequalities is a really important part of this. And I think as we're building this, we are looking at how do we operate at a system level, so that we're kind of trying to make sure that we don't have any unwarranted variation, but actually, the data in terms of the individual places and neighbourhoods is going to be really important to understand exactly what roles are needed in what areas, so that we are actually making sure that the kind of when we have an integrated approach, you might not see exactly the same thing in each area. It's going to be very much focused around people's needs and the kind of health inequalities that we've got, that we know exist within the transformation. And I think that's something that's a growing area as well, about how we really make sure we get that data included when we're making our decisions.
Thank you, Rachel. We had one last question in, but I believe Penny, you typing an answer, a response already.
Yes, just very briefly, it's around triangle of care. Absolutely. We're really keen to share all areas of good practice around carer involvement and developments for the future. And we have some proactive input into the workshops from carers, and we'll want to continue to do that. So again, any suggestions, and if you do get in touch with us, really useful if you could say if you're interested in something in particular, or if you're very interested just in the overall workshop. Happy to hear either way, of course.
Thank you, Penny. Yeah, so that's covered the questions. If there are any others that come in, we'll obviously answer them directly with you. But that brings our webinar to an end. I hope that you've all found it useful. As Rachel said earlier, we will be sending around an email later on today that's got a short survey in, which we'd really appreciate if you can complete, just to help us make these webinars as good as they possibly can be as we continue to obviously build and develop them, as well as obviously some more information for you to read through and to share with your colleagues and your peers. So yes,
Megan, could you just mention the next date of the next webinar and what we'll be covering as well?
Yeah, absolutely. So the next webinar will take place on Wednesday, the 21st of December. It'll be the same time, so it's always at midday. And our presenters for the next session are going to be Jenny Edge from our Emotional Wellbeing Service, and Anne Foster, who is our lead commissioner for Brighton and Hove, and they're going to be speaking about the emotional wellbeing service within primary care that has been established and is being expanded, just to give a bit more information about some of those tangible things that we've done already and the noticeable impact that's starting to make. So yes, make sure you register to attend that one on the 21st of December.
And Megan, can I just before we finish, just pop in, there was a little comment, which was a really important comment around established work and R's roles, social prescribers, etc. We'll talk about that a lot more at the next meeting. Absolutely critical. And it was, again, very good to see the system coming together at the workshops and already starting to think about how they can work together differently and better. So thank you. And there'll be definitely some more information on that in the next webinar.
Thank you very much, everybody.
And please encourage your teams or other people to sign up to the webinar as well. The more the merrier. We certainly would love to see many more faces trying to on these webinars as well. So thank you.
Thank you.